speed has been a constant companion for my preparation. And since 2021 only I started preparing. I listened to your videos also, which came in March, April. Obviously, speed, sir, in last 2 years, speed videos have been a great help.
So I bring in all the wishes and greetings on behalf of all the faculty members of Speed Medical Institute to Dr. Kumar Nishant for scoring a very good rank number 18 in DM Pulmonology and Critical Care and Sleep Medicine. Congratulations to you.
Thank you, sir.
Great, doctor. Can we know your brief background history from where you started till date?
Sir, I belong to Ranchi, Jharkhand, and I did my schooling from here only. And after that, I did my MBBS from Amrita Institute of Medical Sciences in Kerala, Kochi. And then I did my MD Pulmonary Medicine from Himalayan Institute of Medical Sciences, Dehradun. And I did 2 years of SRship after that, after completing. Until 2023, October, I did my SRship. And now in this April, INISS means now then I came back to my hometown and prepared for INI.
Excellent, doctor. Now, the idea to do a DM Pulmonology and Critical Care and Sleep Medicine is what, after PG or during PG itself? When did you decide?
I loved the subject during my MD days also. So, and I felt that it's good to have, means to apply and try for DM degree. So I was, apart from seeing patients and reading books, especially during the preparation time, after that, I was trying to attempt since 2021 only.
Great. Now, once you decided, and how did you start? When did you prepare? How much of time dedicated for this? Can you share something on your preparation strategies?
Sir, speed has been a constant companion for my preparation. And since 2021 only I started preparing, but for some or the other reason, I was like coming close to counseling, or I was a part of counseling, but not able to secure a seat, like missing a rank by a few seats. So it was happening since last 1.5 years. And during this attempt, it was like almost, I gave 3 to 4 attempts of INISS before. And but this time I qualified also. I was previously missing by first round by like 1 mark, 2 mark. Continuously this was happening. So I did some changes in my strategy, and thanks to you also, sir. I listened to your videos also, which came in March, April. So I was trying to, I did some changes in my strategy that, and it proved to be fruitful, sir, this time.
Great, doctor. Now, was it a full-time preparation or working in preparation?
Sir, working also, sir, but just a part-time job only. Full means preparation plus job was there, part-time job was there, and along with that I prepared also.
How many questions did you attend this exam?
Sir, out of 80, I attempted 72.
Very good, very good.
Sir.
Doctor, can you tell us the number of questions asked in each part? Pulmonology, general medicine?
Yes, sir.
Critical care.
Pulmonology, sir, based on last few papers and this paper also, general medicine will always be minimum 30% of the paper, and maximum can go up to 50%. And pulmonology definitely is 50% to 60%, means depending on the 50 to 70%. So then they slightly change the proportion in every paper, but more or less minimum 30% from medicine will be there, and minimum 50% questions will be from pulmonology.
Okay. Doctor, can you share something on your interview experience and interview part?
Sir, I gave the interview for the first time, so it was a bit nervous moment for me also. I was preparing for it, but the thing which I realized after giving the interview was that they asked very basic questions, which we are supposed to know, and we don't need to know too much hi-fi stuff from what my personal experience. I mean, others have also given, but to me, they didn't ask any. One question was a bit off topic. Otherwise, most of the questions they asked was what we studied, what we should know from our basics only.
Excellent. What will be your message to the students who are aspiring for DM Pulmonology, Critical Care and Sleep Medicine?
Sir, the mistake which I was making since last few attempts was that I was very comfortable with Pulmo and I used to do Pulmo well only. But medicine part, I prepared like I didn't give much time. So this time, obviously, I was continuously brushing up. Even though I was continuously brushing my basics in Pulmo continuously with my studies, medicine part along with Pulmo is very significant. Medicine part also, we have to give some good amount of time, like at least try to finish up 3 to 4 to 5 systems, like which are the most important ones. And along with respiratory and critical care is always there. So the preparation, the part of which you're prepared means then we can be sure that 80% to 90% of things we have at least read somewhere, means Pulmo plus medicine part. So with this, I was not taking care of before, especially for INISS. So this time I made that correction, and obviously always Palmo was always the comfort zone, but medicine part was this time I tried to correct that, and it fetched results, sir.
Great. Time to thank. You can use this platform to thank whom all you want to thank who have built your career so far.
Yes, sir. Firstly, I thank God. I thank my parents, my teachers at all the medical colleges, and my family members, means my parents, my wife, my grandmother, grandfather, and apart from that, sir, in medical college, my all my seniors, my teachers, professors, juniors, I've learned a lot from them. And then in the speed, obviously, speed, sir, in last 2 years, speed videos have been a great help. Great help means I've been following, especially Dr. Saurabh sir and Dr. Vidushi ma'am's classes were excellent. Latest guidelines, textbook things, means they knew what is to be asked. We just need to focus on that. Apart from that, we obviously needed to read guidelines and everything. So their teaching was excellent, sir, and big thanks to them. Obviously, without their guidance, without their teaching, and big thanks to you also, sir. That your
Thank you.
video, I remember, I knew the way you described that time, that the way people prepare for INISS, they focus on NEET and they prepare less for INS. That video of your March and April came, that was very important learning for me, and that made me think that I should go ahead properly with this preparation, sir.
Excellent, doctor. Very nice to have your session today. And we once again wish you all the very best and all the success for a very great and wonderful career as a
Thank
DA
you. Thank you so
pulmonologist and
much, sir.
critical care and sleep medicine specialist. Best wishes to you, doctor.
Thank you so much, sir.